Hi everybody, this is Katie again. Welcome to episode 2 of the Moyamoya Diaries. I promised that I would do a video right before my surgery, and as luck would have it, my surgery is tomorrow. It is about 8:30 in the morning according to my clock on January 9th, and my surgery is at 8:45 tomorrow. So I'm hanging out here, chilling the day before with my cat. Hold on, let me pick him up and show him to you. This is Eddie. Hi, Eddie. This is my little kitten, Eddie, and he's just hanging out with me while I'm making this video. He's been laying in my lap for a while, and I thought I'd show him because he's so cute. Look, Eddie. He's like, why did you wake me up for this? Oh, there's a kitty on screen. I'm just kidding. He probably doesn't even see it. But anyway, so this is Eddie, and he's hanging out with me. You want to go lay back down, buddy? There you go, sweetie pie. He's so cute. Anyway, so I'm just hanging out here with him, and I wanted to make the video about how I'm feeling this morning. And, if it had really hit me that I was having brain surgery tomorrow morning, I think I would be scared. But oddly enough, it hasn't really hit me yet. I've gone through all of the imaging testing and the diagnosis and all the pre-op crap and all that stuff. And, it hasn't really struck me that this time tomorrow I will be raring to go for surgery. So maybe that's why I'm doing okay this morning. If there's anything I'm really going to be nervous and apprehensive about, it's the anesthesia, which I am a little bit curious about, I guess I could say. But I have had surgery before, minor surgery. I had a wisdom tooth extraction when I was 18, and I had 3 wisdom teeth that were impacted and had to be surgically removed, just pulled like a normal wisdom tooth extraction. So I was put under anesthesia for that. The procedure was about an hour, whereas my surgery tomorrow is about 4 hours. And, the anesthesia experience that I had with my wisdom teeth was pretty awesome, if I do say so myself. They gave me laughing gas in this little nose cone thing. I guess while they were putting the IV in my arm, maybe they didn't want me to realize what was going on, and I didn't realize what was going on, so that was pretty great. But I do recall sitting in the chair after they turned on the gas, and I started laughing. See, I'm laughing right now because I'm remembering it, but I was breathing in, and I remember breathing out and then doing that and saying, "Whoa, Doc, I feel awesome," because I did. And then they were like, "Okay, Katie, that's good. Now we want you to count backwards from 10." And I was determined to get to 1 while I was counting backwards. But I think I got to 9, or maybe I said, nah, as I was counting, and then gone, and then I was down. I had a very tiny whisper of a dream that I can recall. I think I was it was something like I was floating towards an island, or I was in water. It was some kind of a falling and then a water feeling. And then it was over. And then the nurse or whomever it was in the room was at my shoulder, one of my shoulders. And I'm sorry, my face is really itchy this morning. And she was like, "Katie, your surgery's over. Your wisdom teeth are out. Everything's over. So wake up." And I was laying there okay, I was real groggy. I was probably drooling somewhere. I don't even know. But I don't really remember much more than that. I don't remember if they wheeled me into a recovery area or if I walked, or maybe they carried me. I don't know. But my next clear memory after being woken up was laying in a reclined chair in the recovery area, shaking because I was really cold. And they gave me a plaid blanket to warm me up, and it helped a little bit, but I was still shaking as I was breathing off the anesthesia. So, hey, if the anesthesia tomorrow is like that, then am I okay with it? Because that was a pretty good experience. I didn't have a problem with that. Eddie's being really cute, so I might look down occasionally. He's sleeping. Oh, you all right, buddy? Okay. He's so cute. Anyway, so the procedure I'm having tomorrow is cerebral revascularization surgery. There's a couple different ways. Oh, he's getting up. Eddie, what are you doing? Oh, now he's going to lay right here on the bed, not in my lap anymore. Anyway, cerebral revascularization surgery, really the only big treatment for Moyamoya that is effective that I've heard. There's a couple different ways they can do it. I'm having a two-part procedure that is the more indirect way of providing blood to the brain where the vessels are narrowing. The procedure I'm having done is called the EDAMS procedure, EDAMS, kind of like the cheese, Edam cheese. Anybody had Edam cheese before? I have. It's pretty good. But anyway, EDAMS stands for, if I get this correct, encephaloduro-arteriomyosynangiosis. Bam! So I'm having the awesome procedure done. But what basically it does, or what the procedure involves, is that the neurosurgeon will create two bore holes in my skull on the left, and he will put two sources for which more blood vessels can grow into the left side of my brain. The two sources that he is going to release from their surrounding tissues, lay down the boreholes and stitch down, is one of them is the superficial temporal artery, which is healthy and is not affected by Moyamoya. So he's going to use that in one borehole. And then he is going to use a piece of my temporalis muscle on the left, and he's going to stitch that down into the other borehole. And both of those sources, within 6 months, should grow new blood vessels, which will take over the circulation on that side where it's kind of lacking right now because of the Moyamoya. And if all goes according to plan, I shouldn't have any more TIAs, and I shouldn't be at that great risk for stroke like I am right now. So it's very encouraging. This procedure and other procedures like it have a great success rate for people with Moyamoya. They've done these procedures in children because children can be affected with Moyamoya. They've done them, I guess, in people my age. They've done them in people that are older, and great success rate. So I'm really encouraged by that, and I'm very encouraged by all the kind people in my life who have been giving me hugs, telling me that they'll pray for me and for my doctors, because that's really important. And it makes me feel good. It makes me feel comforted in this time of uncertainty. So I'm doing okay today. My best friend Gail is coming over tonight to hang out with me and Jim, my husband. And tomorrow we are going to make our way to the hospital with my parents. So I'm going to have my whole surgery entourage rolling in with me to the pre-op area. And it should be okay. So right now, 24 hours before the surgery, I'm doing okay. Talk to me tomorrow morning. Maybe I'll be freaking out, but we'll see. I hope I don't freak out. I don't want to be that person, because I know that if this is successful, then everything's going to be okay. So out there, if you're watching, keep your fingers crossed for me tomorrow, and I will be coming at you again sometime after January 10th. So thanks for watching, and I'll see you later. Bye.